I'm Brian Reiter, and today I'm going to discuss with you arthroscopic rotator cuff repair. The rotator cuff is made up of 4 muscles and tendons that anchor the head of the upper arm bone, the humerus, securely into the socket of the shoulder joint. The muscles of the rotator cuff pull on bands of tough, inelastic tissue called tendons to raise and rotate your arm while keeping the shoulder joint stable. A torn rotator cuff causes movement of the arm to be painful, limited, or impossible depending on the severity of the tear. In the most severe injuries, the tendon is torn away from its attachment on the head of the humerus. Because blood supply to the tendons is poor, a rotator cuff tendon is unable to heal itself after a complete tear, and many patients require surgery. Your rotator cuff can be injured by falling, lifting, pulling, or doing repetitive overhead arm motions such as pitching, swimming, and golfing or tennis. In addition, the normal wear and tear that accompanies aging can weaken and break down the rotator cuff tendons. I would begin by making a small incision in your shoulder and place an arthroscope or a small camera inside the shoulder joint. Next, around the shoulder we make a few other small incisions to place instruments to be able to manipulate, grab, and repair the rotator cuff. Next, I'd make a few small holes in the bone where implants called anchors will be placed. Nowadays, these anchors are not made out of metal, but made out of a material that can turn into bones slowly over time, so patients don't have to worry about setting off alarms in the airport. We loop sutures through the anchors and we stitch them to the repaired tendon to reconnect the tendon to the bone. So after we successfully repair the rotator cuff, we close up the small incisions with a few stitches. We put on your post-operative bandage, a cold compress, and a sling. Then you're woken up from anesthesia and you're taken to the recovery room. You're usually there for about an hour, and once you're comfortable and awake, you go home. So it's an outpatient surgery, it's not done in the hospital, or if it is done in the hospital, it's done on an outpatient basis. You'll then follow up in my office about a week later and we take out your sutures. We then give you a prescription for physical therapy with a very detailed protocol on what you should and shouldn't be doing in physical therapy. And that protocol may last anywhere from 3 to 6 months, depending on the severity of your injury. But all along, it is a well thought out plan, and it's executed until you're fully recovered and back to your normal activities.